When Dr. Arav Mehta first set foot in the United States, his heart swelled with hope and ambition. Born in Hyderabad, India, Arav had grown up in a modest family that valued education above all else. His father was a retired railway clerk, and his mother, a schoolteacher, often reminded him that knowledge was the only inheritance she could provide. After years of relentless study, Arav earned a medical degree from Sanskriti Institute of Medicine, a little-known but accredited college in South Asia where tuition cost a fraction of American medical schools, just $800 for the entire program. To Arav, this wasn't just affordable, it was salvation. While his peers in the U.S. accumulated mountains of debt, Arav felt blessed to have completed his education without financial shackles. But what seemed like a dream would soon unravel into a nightmare when whispers of his cheap degree began circulating. His arrival in Boston, a city known for its cutting-edge hospitals and world-class universities, was supposed to be the beginning of his career. Instead, it was the spark that ignited a racial and cultural firestorm. His colleagues eyed him with suspicion, not for his skills, but for the price tag of his education. And as rumors spread across medical forums and social media, Arav's credentials became the target of ridicule, sparking debates not only about the quality of foreign medical education but also about immigration, race, and fairness in America's healthcare system. The backlash began subtly, almost innocuously, with sarcastic jokes whispered in the hospital corridors. Nurses smirked when introducing him as the $800 doctor. Patients asked in veiled tones whether he had learned his craft from YouTube or some discount diploma shop. But the whispers soon gave way to full-blown hostility when Dr. Jessica Cole, a Harvard-trained physician burdened with $400,000 in student loans, publicly questioned Arav's legitimacy at a staff meeting. "How can patients trust their lives," she demanded, "to someone who paid less for their degree than I did for a single semester's textbook?" The remark, clipped and shared online, went viral. Overnight, Arav's story became national news, the $800 doctor treating Americans. Media outlets framed him as either a fraud endangering patients or as a symbol of America's broken medical education system. Social media turned uglier still. Hashtags like #DollarStoreDoctor and #FakeMD trended on Twitter. Strangers flooded his inbox with racial slurs, telling him to go back home. Arav's skill, dedication, and long hours saving lives in the seemed irrelevant compared to the price of his degree. Ironically, while critics labeled him incompetent, hospital performance metrics showed his patient outcomes were among the best in his department. But reason and evidence had little chance against prejudice amplified by politics, student debt resentment, and xenophobia. For many, Arav had become a convenient scapegoat, a brown face onto which they projected frustration with an overpriced and inequitable healthcare system. As the controversy deepened, Arav found himself trapped in an exhausting cycle: prove, defend, repeat. Every day he arrived at the hospital earlier than his peers, double-checking charts, meticulously reviewing diagnoses, and treating patients with unwavering compassion. Yet, his efforts went unnoticed because the narrative of the cheap doctor overshadowed his humanity. News anchors debated whether his degree should be recognized at all. Politicians seized the controversy as a wedge issue. Some demanded stricter verification of foreign doctors, while others argued America's healthcare shortages required more professionals like him. Arav's family in India watched the storm unfold with horror, urging him to return home before the pressure consumed him. But Arav was stubborn. He had sworn an oath to heal, and he refused to abandon patients who depended on him. His fiercest supporter was Dr. Maria Gonzalez, a Cuban-American surgeon who had faced similar discrimination early in her career. She reminded him that prejudice was not a reflection of his worth but of people's fears. Still, Arav could not escape the gnawing loneliness. The hospital cafeteria emptied when he entered. Colleagues avoided eye contact. Even patients, influenced by headlines, requested American-trained doctors. The final blow came when an investigative journalist ambushed him in the hospital parking lot, thrusting a microphone in his face and asking, "Do you think American lives are worth less than your $800 education?" Arav's silence, born of exhaustion rather than guilt, was twisted into an admission. The headlines screamed, "Doctor refuses to defend his $800 degree." The breaking point came one winter evening when a multi-car accident flooded the with critically injured patients. Among them was a prominent senator's daughter, unconscious and bleeding internally. With chaos all around, Arav took charge, barking orders, performing emergency procedures with the precision of a seasoned veteran. Hours later, the young woman's life was saved, by the very doctor the nation mocked. The senator, initially skeptical, publicly thanked Arif in a press conference, declaring, "I don't care how much his degree cost. He saved my child when seconds mattered." That statement shifted the narrative. Slowly, journalists reframed Arif's story, portraying him as the embodiment of skill over privilege. Think pieces emerged. Does debt equal competence? Why foreign-trained doctors might save America's healthcare crisis. Supporters flooded social media with hashtags like #skill-not-price and #Dr. Arif saves lives. Yet, even with growing support, Arif knew the scars of the backlash would remain. America's medical system wasn't just broken financially, it was broken socially, where race, money, and prejudice outweighed merit. Arif decided to use his newfound visibility not for revenge, but for reform. Partnering with Dr. Gonzalez, he began advocating for policy changes that would evaluate doctors by their results rather than the cost of their degree. He became a reluctant activist, his soft voice echoing in congressional hearings where he demanded affordable medical education for all. Years later, Arif looked back at the storm that nearly destroyed him. He had endured slurs, suspicion, and systemic bias, yet had emerged stronger, reshaping the very conversation that sought to erase him. His activism led to scholarship funds for low-income American medical students and smoother pathways for qualified foreign-trained physicians. He published a memoir, Beyond the Price Tag, which became a bestseller, chronicling not only his battles but the resilience of countless immigrant doctors who had paved America's healthcare with sweat and sacrifice. Still, the backlash had left invisible wounds. Even as he was invited to keynote conferences and receive awards, Arif carried the memory of those nights when he questioned whether he belonged, when patients doubted his skills, and when colleagues whispered behind his back. Yet he refused to let bitterness define him. His story became a testament to the truth that competence cannot be measured in dollars, and dignity cannot be stripped away by prejudice. The $800 doctor had become a $1 million symbol of perseverance, justice, and humanity. And though the racial backlash revealed America's deepest insecurities, it also revealed something stronger: the ability of one man, armed with nothing but knowledge, empathy, and determination, to rise above hatred and change the system itself.